Hi, my name is Bethany Kelly and I'm a diabetes specialist nurse down in Southampton.
Hi, my name's Tamsin Fletcher-Salt and I'm a diabetes specialist nurse at the Royal Stoke University Hospital.
Hello, my name is Amanda Epps and I'm a diabetes specialist nurse in Medway NHS Foundation Trust, which is in Kent.
And I'm Vicky Alabraba, a community diabetes specialist nurse working in Liverpool.
So we are the DSNs from the Diabetes Specialist Nurse Forum and also Team Diabetes 101. And we're here to talk to you about how to give insulin in the right way. And we use those quotes there because everyone will have their own right way. Some people will be using injections, some people will be using pumps, some people might be using things like iPorts and other gadgets. So we wanted to try and be inclusive of all of us. So that's why we've gone with that title. So first slide that we wanted to highlight was just that there's lots of tricky challenges to navigate around when you're starting insulin and also when you're taking it. So just all of these worries that are on this slide are just entirely normal for all of you. And we just wanted to highlight that. Please talk to your DSNs, talk to us if you're having any of these problems, and because we can help and there are things that we can give you or forward you on to for some more support. So really common ones are you might feel really nervous about using needles and having hypos with insulin. You might feel guilty or to blame for needing insulin. And we find that's really common in people with type 2 diabetes. It messes with your daily life and being spontaneous. So, you have to plan now and you have to carry kits around with you. And that is kind of annoying, takes away the spontaneity of your day. And having to take insulin can sometimes remind you of having your diabetes, and sometimes you might just want to forget, and that's perfectly normal and okay, and we do understand those things, so please do speak to us. Okay, so there's lots of positives in a good technique with whatever you're using, so whether you're using a pump or you're using injections. We know that the more you're monitoring your glucose levels, so the more you're checking your sugars and things like that, it's proven and shows that you will get better management with your diabetes. And so it can also show that you're taking the lead of your diabetes. So it's not that your diabetes is controlling you, but you have control of your diabetes. We also know that it reduces your long-term risks, and it also can improve your quality of life. So you have less restrictions and also less of the ups and downs of diabetes as well. So the hypos and the hypers. A little fun fact that we always tell everyone. So unfortunately, we can't be in a room with you all to kind of do this how we normally would, but we would normally kind of say, how does everyone think? How deep does everyone think their skin is? And whether we're a size 8 or we're a size 18, everyone's skin is all about 2 millimeters deep. So everyone should be using a size 4 to 5 millimeter needle. So a long time ago, you used to think the bigger people were, the bigger the needle they needed. But now we know that the research shows everyone only needs a 4 to 5 millimeter needle. And that's because we want insulin to be getting just under the tissue, under the skin. So that's called subcutaneous tissue. So we don't want insulin to going into the muscle, because we know if we're getting insulin into the muscle's got a really good blood supply, and so any muscle that gets any insulin that gets into the muscle will be absorbed unpredictably, and you can end up with hypos. So what is a good MDI technique? So MDI stands for multiple daily injections. So if you're using pens to give your insulin with each day, you'll hear DSNs talk about this all the time. And so these are the top tips for using pens. So we would say use a brand new needle every time. So needles are quite often now, they're smaller, they're a little bit cheaper because they're mass produced. So you can keep changing the needle every single time. You have enough of them on your prescriptions and things, so you shouldn't have a problem with that. Check the needle is clear every time with a 2-unit air shot. Always inject at 90 degrees into a non-lumpy site. So we'll talk a little bit more about lumps as we go along. And hold the needle in place for 10 seconds when you do your injection, just to ensure that all of that insulin has gone through the pen and is in your tummy, or your legs or your arms. And make sure that you dispose of the needle safely into sharps bins. So we should always be putting them in sharps bins. Don't put them in the normal rubbish because it puts people at risk of having sharps injuries. And please try not to leave the needles on your pens. This wouldn't be an injection technique talk if we didn't have a go at you about leaving your insulin needles on your pens. But this, why we go on about it so much is because it exposes the insulin in your pens to bugs and air bubbles and leakages, which is not advisable for you guys. So it's just to keep you guys safe, and that's why we talk about it.
Hi, so I'm going to talk to you about good pump technique. So with the pump, it's a little bit different because you're not injecting every day. You're putting a cannula in, and that cannula will usually stay in for an absolute maximum of 3 days. So some cannulas do need to be changed a bit more often. But an absolute maximum of 3 days. So first of all, if you're having any problems with your blood glucose levels, then you need to go and look at both the pump and the cannula. So first of all, with the pump, just to double check that you've got no alarms on it, that there's not been any failures, no cracks in the case, has it been dropped or knocked against anything. There's some very specific types of problems with certain pumps, particularly about an O-ring leak. So if you're on a pump, you will have had warnings of this if you're on that pump. So checking that you've got no air in your tubing. Two rare things that can happen is that the insulin can be denatured, or you can have insulin crystals in the line. So those are really rare things. But there are a couple of insulins that some pump companies do say that shouldn't be used in their pumps, or to sort of avoid. And if you're on those pumps, you will know those insulins. But if you're concerned, you can always contact your DSN team, as they'll be able to advise you. The lines themselves, so the line from the cannula to the pump, if you're on a tubed pump, they shouldn't in theory be able to kink, but sometimes they can do. So just to double check that you've got no odd kinks or compressions in the line. And also, obviously, if you have pets or children, just watch out for those teeth being chewed on the line, or cannulas being pulled out without you realizing it. So the cannula site itself, that is pretty much anywhere that you would normally inject, except for arms, unless you're on the Omnipod. But again, do check with your with the pump company or your DSN, because there's new cannulas coming out all the time, and they may be able to be used in arms and things like that. The cannula can be occluded, so depending on where you've sited it, it may not be in a good site. So again, you know, we'll talk about checking your sites, and that's the same for cannula placements as it is for injection techniques. It may have become partially or completely detached from the pump, whether that's at the cannula site or even at the reservoir end close to the pump. Leakages along the cannula, usually you can smell insulin. It's got a pretty unique smell. So if you're having any leaks, they usually, hopefully you can smell them, or even if you feel a bit of wetness around your cannula site, it's worthwhile checking that. And skin reactions. So the cannula has got surgical adhesive to it. And if you're having reactions to that, that could be causing you to have problems with insulin absorption. And as we said, you should be changing your cannula every 3 days at least. So if you don't change it that often, or if you've forgotten, or you just missed a cannula change, that could be causing the insulin to not be absorbed. And lipos, which we will talk about again in a few slides, and also site infections. So really keep an eye that you've got any redness or soreness around any cannula sites, to keep a close eye on those, and keep everything clean, and even seek medical advice if you need to. So as we said, there are a multitude of different cannulas. A lot of the cannula are very similar to each other. So different pump companies will use very, very similar cannulas. So if you find one that suits you, then you know, you may be able to stick with it even with a different pump. change of cannula length can sometimes help. So just obviously be in touch with your DSN team, or even, you know, the pump company. They may send you some samples that you can give a try to and see if they work. They have angled cannulas which you can use, and changing from Teflon to steel. Some people find that that really helps, particularly if you have any problems with kinks in the cannula. So as we said, you know, most cannulas, if they're Teflon, you need to change them on a maximum of every 3 days. Obviously that does depend on how much insulin you're going through, as well as if you go through more insulin, it may be that you change a cannula a bit more often when you change the whole set. If you're on steel, then it's an average of every 2 days, and an Omnipod is very similar in the sense it's every 3 days. But again, depending on how much insulin you go through, you may find that you're changing your Omnipod more often than that. So as we said, skin reactions, they do use surgical grade adhesive, and some people do react to that. We would say that, you know, it's worthwhile speaking to your DSN to see if they can help you if you are having any problems, but you can use things like a barrier spray to try and help you with that, and worst case scenario, a referral to a dermatologist if you find that you are really struggling with any kind of skin reactions. Tubing, so obviously, as we said, the majority of the pumps are tubed pumps. There are a few out there that are like the Omnipod that are not, so sometimes it's worthwhile just taping the tubing a little bit away from the pump to stop it being tugged, and also keep it in sight. And then those annoying unexpected highs, these can be down to the cannulas, the tubing, pump failure. So hopefully some of the tips that we've just given you in the last couple of slides will help you. So sites you can use. So I think, you know, everybody probably has a specific site that they do their insulin, or perhaps you have one site for your fast acting and another site for your long acting. But it's always really important that you rotate your sites. So don't just stick to the left-hand side or the right-hand side, but just do whatever suits you in the sense of rotation, but try and use as many different places as possible to try and cut down any problems that you may get from doing the injections that you do. So this picture just shows you the areas that you can use. So your thighs, your arms, your abdomen, and your buttocks are all the areas that you can use for injections. So changing sides, alternating from right side to left side. You can rotate, you know, using a clock pattern or like a castle pattern going up and down. But as long as you do it about a finger's breadth from the last injection point, then it's absolutely fine. And some companies do produce a little chart that you can kind of stick over yourself. And a lot of the pump companies, well, some of the pump companies do sort of like apps and things like that that says wherever you put it, so you can sort of remember where you've been in the last few times. So, okay, so yeah, so just important about rotating. And then factors affecting insulin absorption, there's probably way too many to sort of count. People will come up with some other ones that they probably know about, but these are probably the most common ones. So the weather, you know, whether it's hot or cold, also whether you've had a bath or a shower, a hot bath or shower after doing an injection will affect the absorption. The size of the dose, doing exercise after you've done the injection, the lipos, as we said, the lumps that we're going to talk about, if you rub your site after doing an injection, different sizes of needles, different types of insulin. So loads of different reasons why your insulin may be absorbed differently, and it's worthwhile just remembering those when you're doing the injections and looking at your blood glucose levels.
So lipohypertrophy, or lipos, are when we inject in the same place over and over again, and we get these kind of fatty lumps come up. So it's really easy to do, because when you do your injection, especially if you're sitting at the dinner table or something like that, you tend to kind of land in the same place all the time. So as Tamsin said, we need to make sure that we are always rotating sites and that we're always moving it at least a centimetre away from the previous site, because we want to avoid this damage that causes the fat cells to kind of overgrow and become abnormal and pulled into a skin layer. So you get these soft fatty lumps that you can sometimes see at the sites, or you may be able to feel them under your skin. They often don't hurt, and that means that we use them more often because we can't feel it anymore. So why are lipos a pain? Well, if you inject into the lipos, the insulin can sit inside them and then it's not absorbed properly, because the lipo doesn't really have a blood supply, and so the insulin effect is blunted. And the issue is that you will have a hypo if you then inject the same amount of insulin into a different area or at the side of the lipo where there's a better blood supply. You might end up having a low blood glucose because all of that insulin is now being absorbed. When we inject into lipos, it means that the insulin doses will likely be increased because you think, oh, it's not working, I'll put my dose up. However, it could just be that it's just not being absorbed. And so they can trick you into thinking that you need more insulin. And they can really explain these up and downs that you might get. They might be, you might be able to explain those unexplained ups and downs. So everybody stand up on your feet. And we need you to grab some lubricant or some shower gel for this bit. So you have to stand up, that's really important. Remove or loosen clothing and use lubrication such as shower gel with a flat open palm. You can have a really good feel around your tummy using your fingertips. Sometimes I think it's easier to do this in the shower because you've got the shower gel and that's probably the best place that you can find. So if you find a lipo, then they could be small, they could be large, but you need to mark them with a Sharpie. So a little felt tip pen, draw around it where you find it, and then avoid injecting into that area. You will need to talk to your team though, because you probably will need to reduce your insulin doses substantially. And once you inject into healthy, fresh tissue. A little bit about storage of insulin. All unopened insulin should be stored in a refrigerator between 2 and 8 degrees. I find sometimes refrigerators can freeze things. If you put it at the back of the fridge, mine's always frozen. So the butter compartment tends to be a better place to put it where it doesn't get frozen if you've got a dodgy fridge like mine. Open vials, pens, cartridges can be kept at room temperature for 1 month. So the one you're using, you keep at room temperature, but all unopened ones need to stay in the fridge. And always make sure you check that expiry date, and those ones that are being kept at room temperatures, just avoid extreme temperatures. So don't leave them in the car where they might get hot. Don't leave them in a caravan. I did actually have a person do that before, and it got to sort of 40 degrees in the caravan, and the insulin was completely a different color by the time she found it. So it's really important that we keep to those temperatures.
So I'm just going to talk a little bit about some of the gadgets that you can use to help you inject if maybe you're new to it and you're finding it difficult. So there's something called the iPort, which I suppose is a little bit similar to the cannula that is used for an insulin pump, but obviously it doesn't have any tubing attached to it. So it's a little cannula that sits under the skin, and you inject your insulin pen needle into the iPort, and that's how it delivers the insulin. It is something that is attached to you permanently for the sort of 3 days that you use it, and then you need to change it. And again, you do need to be a little bit careful about sort of making sure that you're looking after that area so that there's, it's not getting sore or any signs of infection. There's also something called a tickle flex, which is quite cool. So this is quite useful for people who maybe find the injections painful. It's quite a good distraction sort of mechanism. It fits on the end of the insulin pen, and it means that you can't necessarily see the needle, and it sort of gathers the skin together when you go to inject, and it keeps it secure. So you can purchase those between sort of £15 to £20, and that can really help some people. Obviously, needle phobia that we talked about earlier, there are psychological services available for people, which I'll come on to in a little bit, and this can really help people who find it particularly difficult to give insulin injections. There's also something called the Frio bag, which is a bit like a cool bag, but specifically designed for insulin. So when you're traveling and you need to keep your insulin at a happy temperature, that's something that comes in really useful. And also Tamsin mentioned about the injection grids and the rotation sort of charts. Some companies produce these to help you remember to rotate your injections and to make sure that you are using different areas within your injection sites. So just recapping on some of our top tips. Yes, we always say use a brand new needle every time, and obviously there are many reasons for that, and we've talked about the lipos and how it can affect the absorption of insulin. Just to recap that all of us, regardless of our body size, because of our skin thickness, should be using either a 4 or a 5 millimeter needle on our insulin pens. For those people who still use a syringe and a vial to inject, the shortest needle available is an 8 millimeter needle. So if you are using an insulin syringe with an 8 millimeter needle, you would definitely need to use a lifted skin fold to reduce the likelihood of injecting into muscle. With those shorter needles, the 4 and 5 millimeter, children or very slim adults may be advised to use a lifted skin fold, but obviously your diabetes team would advise you on whether you need to do this. It's a good idea not to inject your insulin straight from the fridge, because when it's cold, sometimes it can just make it more uncomfortable. It can sting a little bit. So always try and let your insulin warm up to room temperature before you inject it. For those of you who maybe used a mixed insulin or a cloudy insulin, do make sure that you resuspend it properly before you inject, particularly with the mixed insulins, to make sure that you're getting the right proportion of the shorter and the longer acting insulin. Now, some people on particularly large doses of insulin may be advised to split the larger doses into 2 smaller doses. And again, this is from an absorption point of view. If you think about the volume of the insulin, the more you give into one area, often once it goes past a certain dosage, that can affect the absorption. So it may not work as well, which in turn will have an effect on your blood glucose levels. Really good idea to rotate your sites, as we said, and try and get into the habit of checking for lipos once a week if you can. And obviously, if you find a lipo, sorry, I can't say it, like Amanda said, make sure you mark it and avoid using that area. But if you do find a lipo and you've never had one before, please speak to your diabetes team about whether your doses of insulin need to be altered with you using a fresh site. And please make sure that you dispose of your needles safely in your sharps box and avoid obviously putting them in your normal domestic rubbish. Just a few frequently asked questions, and it might be a question that you have. Now, if you do have any other questions, please do pop them in the question and answer box or the chat box, and we will do our best to answer them. We've had, some of our patients over the time have possibly been using a certain brand of needle, and they come to pick up the prescription 1 month and all of a sudden they've got a completely different brand. And why does that happen? Sometimes with meds management teams and cost saving work, they may look at sort of brands that people are using. However, if you find a particular needle that suits you better, please let us know. Please let your GP know. We would rather you use your insulin because of a needle that you prefer to use rather than obviously something that you're not happy with. So we just need to know about it and then we can do something about it for you. Just coming back to needle phobia, it's more common than we think, and it is treatable with psychological therapy. You can ask your GP or your diabetes team to refer you to the local mental health team. do make sure that it is marked as urgent so that you get the help that you need in a timely manner. And just an important thing to note, that if you live in Wales, there is a really good resource from the Talking Type 1 series called Not Okay with Needles. And it's a book which is full of amazing techniques that can help you overcome your fear. Obviously, as diabetes specialist nurses, we are there to help you. We can recommend some of the gadgets that we mentioned, or we can signpost you or point you in the right direction for further help. But remember, we're there to help you. We're there to support you. And obviously, as specialist nurses, part of our role is to check injection sites, as you know, your practice nurse may do when you go for your reviews as well. There's no set sort of frequency as to how often we should be checking them, but as often as possible, and it's better to check them more often than not enough. And obviously you can do that yourselves in the shower, as we've told you today. So as I said, if you do have any questions, please pop them in the chat box or the question and answer box. If you're a social media lover like us, you can always follow us on the Diabetes 101 account or the DSM forum account, or both. And we do provide some educational sessions online through Twitter as well. Thanks for listening.